You're watching Exit 1055 with your host, Richard Rose.
Hey, good morning. I'm Richard Rose. Welcome to Exit 1055 Long Island. This is your TV 1055 show about all things Long Island. In just a few moments, the plight of the horseshoe crab and why it makes a difference for your health. But we begin this week with a debate over what to do about the ever-worsening opioid overdose crisis. Every week, dozens of people on Long Island overdose from this deadly drug, laced now frequently with an even stronger, more deadly form of drug called fentanyl. They often have to be resuscitated, and sometimes they cannot be brought back by overwhelmed first responders. Now, that has some community organizations made up of distraught parents demanding education about the threat in the classroom, starting this fall, beginning with the youngest of students.
We need to shout from the rooftops that we need to look out for the next generation of kids.
Tracy Farrell stood with other parents forced to bury their children from heroin and opioid overdoses. Her son Kevin OD'd in 2012, and in the 5 years since, overdose deaths in the county have tripled. Now these parents, left holding on to just memories and photos of their lost children, say it's time for dedicated classroom instruction on the dangers of opioids beginning in the elementary schools.
Show pictures of all the children that have died. Show the parents what's happened to them. Show them at the grave sites.
And Matarella's son overdosed 2 years ago.
My son admitted to me he started smoking pot at 12 years old. At 12 years old. They have to be stopped before it ever starts.
But the executive director of the Nassau-Suffolk School Boards Association says when it comes to drug curriculum, one size does not fit all school districts.
Our schools understand that each district, each community is treating these things differently.
Instead, the School Boards Association says there should be a drug recovery high school, something state lawmakers considered but never approved before taking their summer recess. Parents say then they'll deliver their demands straight to Albany.
I don't care if we all have to go to the Department of Education in the state because no one right now is willing to step up.
Fighting for a change, these parents say may save the next troubled child's life. And joining us now, Dr. Simon Zeisman, a certified clinical psychologist, school psychologist, who runs the outpatient clinic years in Smithtown. That stands for Employee Assistance Resource Services. And welcome to the show, Doctor.
Thank you.
So like I said,
Glad
you're a school
here.
Psychologist at one time, certified for that. Why the resistance in the schools to the widespread education about the opioid threat? Some schools saying they want it, others saying we don't really need that. Why is that?
Well, primarily it's because parents don't want their children exposed to the whole notion and idea of drugs. And also there's the element of denial. But that's becoming to decline significantly because it's starting to impact just about every family.
Yeah, is it needed, you think? I mean, do we have to kind of get rid of the denial and face the facts? This generation is doing this substance that's killing them?
It's definitely needed because the children are getting started early. I have a gentleman that came in recently. He started using at the age of 13. He was already using heroin from 13 to 16.
That's like middle school, I believe, right? That would be like
that would
7th, 8th grade, yeah. Yeah, depending on how early you started, that would be 7th or 8th grade. So you're seeing kids that were in middle school coming in that had started their drug addiction back when they were preteens almost.
Yes, and many of them experiment with alcohol, or they happen to find pills in the medicine cabinet, and they get medication or pills from their friends in terms of peer pressure.
Explain the kind of folks you see at your clinic in Smithtown. How are they referred to you? What are their backgrounds? What is the age groups of the people who are coming addicted? And are you finding that it's reflecting what we're seeing in society, that a lot of them are coming in with the opioid problem?
Yes. The predominant age group is 18 through 65.
Wow. What a range.
Yes, and many of them, some of them have been involved, for example, in an auto accident, and they're given a prescription for pain pills. After a while, they become addicted to them, but it becomes more difficult for them to access it. So as a result, many of them are forced to turn to the street for heroin, which is a cheaper version
of an opioid.
Yeah.
And it all comes from the poppy, right? When they say opioid, it's from the poppy.
The poppy seed.
The poppy seed, and these are all different forms of them, including fentanyl, right?
Well, fentanyl is synthetic. So it's actually produced in a lab, and it's actually at least 50 times or more powerful than heroin.
Well, that's crazy. You would wonder why even a drug dealer would want to give that to their patients, because it's like you're going to kill off your addicts, right? I mean, there goes your market. You're doing something illegal, but why would you want to give them something that deadly, and why do the addicts want it?
Well, it's cheaper to produce. Some are able to produce it right there in their own basements if they have a talent in chemistry. So that's a big part of it. Also, the fentanyl patches, they're able to scrape off the fentanyl from that and they mix it. But obviously, it's not a pharmaceutical dose, and as a result, they tend to overdose because it is so powerful.
And you know, we're getting so many overdoses now. There's kind of a backlash in the community, in some communities, where the costs are rising so quickly, because it's not cheap to be dealing with this. Where you send your ambulances out and your first responders, and they're all equipped with Narcan, naloxone. It's this revival drug that's able to bring, in many cases, folks back. But in some communities, they're saying, look, we don't want to pay for this because these people continually relapse.
Well, the cost obviously is rising. We've been very successful in providing treatment to opiate-addicted patients on an outpatient basis.
How do you do that? How do you treat them?
Well, essentially, the first step is to do the evaluation to find out what substances they've been using. Those who have been using opiates, we generally introduce medication-assisted therapy that helps to relieve their cravings and desire.
So you give them something else? What do you give them that's milder, something to sort of wean them off their addiction? And what is that that you're giving them?
You can think of it as a kind of an opiate blocker, because it actually takes away their desire for opiates.
What is the name of it?
For heroin.
Suboxone, I believe I heard.
Suboxone, right. Also Subutex, Subsolve.
And of course, we've had methadone clinics. So, and this is a reopening.
Methadone is a synthetic.
That's been used by some clinics. You don't use it there?
Right, they do. We don't administer methadone, but we do use the Suboxone.
So what kind of track record do you have? Do you find that people relapse? Do they complete your program? Do they drop out? Well, what happens?
Well, we happen to have a very high rate of retention with our patients. So we have a high rate of retention for 1 month, 3 months, also 6 months.
Those are state figures compared to other clinics. They're sticking with your program. What I think I saw 70% after 3 months, 71%. That's considered a pretty good rate, right?
Yeah, 79%, which 79%. Is quite unusual, because in the rest of the state it appears that the numbers are quite lower.
And this matters because we're spending a lot of money on this. So what do you think is the right way to deal with this? Some people are saying, really, maybe we go to cold turkey. Other people want to give them shooting clinics where they can shoot up heroin, so at least they're not doing it in the street.
Well, I don't agree with that, because it's only helping to encourage and promote, the whole idea of people using. What we find more effective is utilizing the methods that we use, because we integrate 3 elements. Number 1 is dealing with the addiction. Number 2 is dealing with any psychiatric issues they might have. And number 3, dealing with any medical issues that they might have. Because some of the patients actually have, for example, hepatitis. So that has to be treated. Many of them are walking around.
They could have mental issues. There's a lot to this, and that's
there are many factors that we need to address in order to keep the person sober. If they suffer from chronic pain, we have non-addictive medicines that we use to help them to deal with that as well.
Well, one of the alternatives to going out and getting high with drugs that will kill you, especially fentanyl. Dr. Simon Zeisman with the Employee Assistance Resource Services outpatient clinic in Smithtown. EARS, as many people know. Thank you for explaining what you do and how you're trying to help out.